Hey, it's Brian Martin, and I'm watching Hello Okanagan in Vernon.
If you like our new merch, t-shirts, coffee cups, etc., what do we have for you?
Every time you grab one of these bad boys, we're planting a tree. And we're keeping it here in British Columbia.
Hey Peter, who do we have on the show today?
Today we have our first repeat. We have Dr. Pete Henley, who's coming back. We did a show with him, I think about 3 months ago or so.
Repeating with Pete.
Yeah. I mean, there's a lot of new info since we last had him on, discussion about the pandemic when it first kicked in. Our first few shows, if our viewers don't recall, and you can go back in on our YouTube page and check it out, but most of our first few episodes were done this way through Zoom because we couldn't really go anywhere. And pretty excited to have him back on and get an update. Should I wear my mask? Maybe I'll wear a mask when I'm introducing him, see what he says.
Will you feel safer?
I think he might. Hello, Okanagan, and welcome back to another episode. You may be wondering why I'm wearing a mask here. Well, I guess I don't have to wear it now anymore, but it's almost been 6 months since the pandemic started. And one of our guests is a gentleman who's a doctor up in Vernon named Dr. Pete Henley. And we had a lot of requests to have him back. I wonder if it was his family that wrote us, but I'm just joking. It wasn't, because we know the people that wrote us back. They follow us on social media, but we wanted to update everybody because there's a lot of businesses that are still trying to adhere to provincial health rules. We're almost 6 months into this pandemic, and since the last time we spoke, which was close to 4 months ago, I'm certain there's a lot of new updates that Dr. Pete has to enlighten us with. So without any further ado, welcome back, Dr. Pete Henley.
Thanks, guys. Thanks for having me back, putting up with me again. Thanks.
Well, thanks, Pete. And yes, clearly your letters from your family and yourself asking to be back on the show have worked. So
They did. Yeah, definitely. I would say I'm quite woolly on the subject. So we had a camping trip up to northern BC for a couple of weeks. So we kind of got away from it all and got away from the internet, which was good. But I kind of haven't exactly caught up with all the latest news, so if I'm a bit slow, that's just me.
Yeah, lots to talk about, especially coming up next week with the schools reopening.
Yeah, definitely an important time.
We received an email this morning regarding our little guy, and I think tomorrow we're getting an updated email with basically all the new stipulations and everything that they're going to be planning for the school season. So we'll know more tomorrow, but we're still, I think, a week away from him starting.
Yeah, it's so complicated. I was watching some videos from schools in different parts of the world. In Europe, they've started back at school, and it looks like the same pattern of how we're organising it here, where we're screening the kids as they come in, making sure that best they can take the precautions of hand washing and physical distancing where possible. But it's going to be very difficult with so many kids around, especially the youngsters.
So we're noticing like the cases of obviously like certain weekends, certain periods, they've begun to climb and everything.
Yeah.
But one number and allow me to play devil's advocate for a second here, but one number that we're noticing is obviously the deaths are not extremely high, which is obviously a great thing, while the cases are still on the rise. What is the more important figure in your eyes? Is it deaths or is it the cases that are actually rising?
Well, deaths potentially can follow cases, but that probably gives the clearest indication that the age group that are being involved now are the younger groups. Previously, the death rates, particularly in BC, were up because long-term care homes were being particularly hit. And even now, the deaths that we're getting are still within those care homes. So whilst we're getting, isolated deaths within the community, most of them are in there. So case numbers rise, and as a consequence, you're not getting so many hospital admissions and deaths because the younger group don't get so severely sick, but just spread it.
With school starting up again next week, the only concern that I have as a parent is when the pandemic started, every business had new stipulations and rules, whether it was a certain amount of people that are allowed in, plexiglass walls, or certain dividers, a certain amount of people allowed at tables, a certain amount of people allowed in, say, a business. And when 3 people leave, 3 new people can come in, and so forth. It just seems like we're just being reckless and throwing caution to the wind when we're putting our kids into school. And I'm saying this before I hear what they have to say tomorrow, but you'd think something would be leaked and we would know by now, where I'm not expecting plexiglass walls or anything, but staggered days. And if there's half the amount of kids in the class, the other half, their alternate days can still feel like they're in school by jumping on Zoom. All the teacher has to do is turn on a laptop and put it on Zoom, and the kids follow exactly what he or she are teaching and taking their breaks when the kids take their breaks, like recess and lunch.
Yeah, I mean, I have to say, I looked at the hybrid models that they were kind of running before the summer recess, and they seem to be working. Now, for whatever reason, I'm not a public health expert or an educationalist. They feel that it is apparently safe to bring that specific large groups into schools. Now, they're kind of quantifying them so that the numbers are limited to 60, and you could say, well, my bubble at home is 6, so how come this can happen? Well, they feel that the risk of transmission from children is small, and it certainly has been small. 1% of children have transmitted the virus in previous studies. That's still 1% that could potentially transfer it to grandparents or relatives. Trying to get the balance that they've got to do. Bonnie Henry's admitted that this is going to be difficult, but they're trying to create these larger bubbles. So they have these learning groups that have the same groups of kids, the same teachers, and they're trying to create this enlarged bubble whilst maintaining all the hygiene stuff. So it's the only way that they can get the kids back in. But I still think that there's going to be some room for flexibility. But
another question people might have too is, why are masks so important now when we've been in flu season for decades? We've had the flu around for so long, and why now masks are suddenly so important and need to be worn?
Well, COVID-19 is a lot more contagious than flu is, so the spread of it is so more significant. It's not a cultural thing. It's in North America and Europe, we just don't wear masks, whereas they do in Asia, and it's been shown, down in the southern hemisphere, that because of mask wearing as well as physical distancing, taking those measures, that the actual incidence of flu has been lessened down there, which is good news. But I think people center in too much on it. And it is all about normalization, because at the moment, I walk into a shop and I feel slightly self-conscious because I've got my mask on, and I can physically distance from people, but I think it is the right thing to do. Now, when I went into Alberta and I was in Jasper, everybody had it. Everybody had the mask on. So the people that were the abnormals were the people without them. And during the pandemic, I'd rather be kind of one of the normals and wear that mask, definitely.
Yeah, and I think that's the biggest. I think that's the biggest topic to touch on now too. Is it's not a matter of are you wearing it, are you not? It's just respect on both sides. We don't need to be belittling each other and spreading hatred to each other regardless of where you sit on the side. And again, like I said, simply playing devil's advocate here, but whether you're wearing them, whether you're not, I think the biggest issue that we're running into right now is the sheer hatred and finger pointing of, this is your fault. See, you're not doing it right. People are looking for someone else to blame through all this, rather than just, look, we're all in this together, trying to move forward and trying to get back to some semblance of normal, right?
That's kind of what we're all aiming for, as you say. And if there are measures that we can do to try and get the economy back on track and keep our kids safe and keep us safe, and then let's all work together. I mean, wearing a mask is not a big deal, as an example. Just do it.
Another thing I wanted to bring up too was that statistic that came out a few days ago by CDC for the United States, that the It was quite a it was a headline, let's just put it that way, that 6% of the deaths in the United States were actually COVID deaths. Now, through that, obviously that is a headline, and if you dig into the article more, it sheds a little bit more light. But they've since, I think, retracted. But why don't we talk a little bit about that?
Absolutely. That took off. It got grabbed by all the people that say that this is all BS and it's just nothing. And look at this, there's only 6,000 or 9,000 cases of deaths in the US. Now, I fill in death certificates as part of my job, so I know exactly how they're properly done. And I've had to explain it a couple of times in my Facebook group and in others that in most cases, people get over this if they're young and they don't have any health issues. Most of them get over this. They may have some long-term problems, but that the ones that don't are the ones with the comorbidities, the ones with the blood pressure and the heart disease and cancers and diabetes. And these are the ones that, well, if unfortunately they get severe COVID and die, will have to have on their death certificates these conditions written on them. So the primary cause of the death would be, for example, acute respiratory distress syndrome, which is ultimately what unfortunately what kills them, due to COVID-19. And then lower down on that death certificate, you will also have that they also suffered from blood pressure and heart disease or diabetes or asthma or COPD. So all of those will have one of those comorbidities on it. Only 6% won't have. Now, obviously, this is a condition, this is an illness that impacts typically the elderly, and the elderly pick up these conditions as they get older. So that's how that statistic came along. So they all died of COVID-19. It's just that those conditions made them more susceptible to getting severe disease.
Before we continue with Dr. Pete, let's get an Okanagan update from our very own Elizabeth Flowers.
Hello Okanagan, I'm Elizabeth Flowers, and here's your Okanagan update. The East Kelowna Market is back in full swing this Sunday, September 6th. This free indoor-outdoor market runs every second Sunday until November 15th. The market runs from 10 a.m. until 2:30 p.m. and features a wide variety of local vendors. If you're looking to volunteer this season, look no further than the Central Okanagan Food Bank. The food bank is currently looking for volunteers to help with the sorting of perishable and non-perishable food items and the building of food hampers. If this sounds interesting to you, please email for more information at info@cofoodbank.com. And with the end of summer means the return to school. Many children across the Okanagan will be returning for in-class learning as early as this Tuesday, September 8th. On your morning commute, be sure to watch for children and watch for speed zones. That's all for your Okanagan update, and now back to the guys.
You're watching Hello Okanagan. Subscribe to our YouTube channel and like for more content and episodes.
You were starting a conversation earlier about the flu shots. I think it was David or Dr. Pete. You guys were mentioning flu shots. Since we're on, pretty close to that time of the year, how important is getting a flu shot this year as opposed to any other year?
It's very important. We're going to have to try and ensure that we can get as many people vaccinated as possible. That's not going to be easy. We've got a lot of the physicians all over BC working remotely. We're one of the providers of flu shots. So if I'm in my office one day a week, pharmacies are going to have problems vaccinating because they've got their own customers to deal with their prescriptions, and then they have to, if they're going to vaccinate, they're going to need to put on PPE, space these patients. So with Interior Health pulling out of drop-in clinics, I think we've all got to try and work together to try and get everybody vaccinated.
So let's discuss the United States. Before we get into traveling within our own borders, let's talk about the United States. I know they extended the border closing for another few weeks. I think it's the end of September now.
Well, within the States, the numbers have been going down over the last month, but they've been going down in the big epicenters such as Arizona, Florida, California. But the problem is they've now been going down there, but going up in the Midwest. So where you've got the numbers coming down, you've also got an increase in the others. So the actual reduction in overall numbers is not going down as fast as it should do. So you're gaining in one area and losing in another, unfortunately. So it's really isn't looking good, which is why it's not surprisingly schools are running into problems.
And if we get a second wave, what are your thoughts on what they're going to be doing with businesses once again and travel within our own borders?
I think with the second wave, I think people think they're just going to reel everything back, and that's happened in some countries. But I think they're just going to do what they've done up to this point. Outbreak in Kelowna, then they reduce the number of people that can use rental accommodation to 5. So they limit them. So they increase the steps rather than say, right, we're going to go back to phase 2 or phase 1. So I think it's going to be an incremental thing. They can see things happening. It's not like it was way back when it suddenly hit us. This was something we knew very little about. Nowadays, we know a lot more about it. We're looking at cases. We're looking at hospitalization. So we kind of know a lot more about it, and we have some control over it, definitely.
And what are your thoughts on how long this might last?
Certainly, I think it's going to carry on pretty much as now until we at least get a vaccine, which may well not work, may partially work. That's certainly going to help. And even then, we may get into a situation where we have to live with COVID for the next few years. We live with flu now, so we may need to get our flu shots and our COVID shots. But as long as if it kind of mitigates and brings down the severity of the disease, if you've been vaccinated, then it's going to be a help. And then hopefully we'll be able to start traveling again.
There's a certain amount of numbers that you're allowed within your own bubble. There's a certain amount of numbers that we're allowed within businesses. There's definitely no sports. I know Quebec just moved up their numbers to 250. I saw a soccer game. But if you go to the farmer's market, there's thousands. If you go into, a certain store, whatever, like a box store, there's no limit. But then you're looking at trade shows or a conference where you, like a big box store, say you're allowed 50 people in at a time. As soon as some leave, you're allowed a few more in, as we mentioned earlier in the show. But when it comes to a trade show or a conference, that's not allowed, because if you have 50 people maximum and say 10 leave, you can't bring 10 more in to keep it at 50 or close to 50. It's only 50 at once, and when the show is over, when those 50 people are done seeing what they need to see, the event is actually over. What irritates someone like me who's in the event industry is, why wasn't something created where it's blanketing everything and we all follow the same rules?
Yeah, I totally agree. I mean, there's different rules for different situations. You could say farmers markets are typically outside, so the risks are lessened. You got to look.
You can have a concert outside, but you're not allowed to have that if you could, maneuver people the same way.
Yeah, yeah. But it's getting people in and out of those situations that's going to be difficult. And I saw this one with the sports stuff. I think that's doable, and 250 on a sports thing it's progress. But the trouble is, indoor events and trade shows and exhibitions,
we abide with the amount of people, but as soon as certain people leave, just like at any box store, then you're allowed to bring in a certain amount again that keeps it under that 50 rule.
Yeah,
but you're not
seems
allowed.
reasonable. I mean, you did say that the box stores have a limited number of people. They don't. They have they work out the number of people that can be in there dependent on square footage. So, but yes, you're right. If they're still measuring, and they don't seem to be measuring. They don't seem to be monitoring the people coming in and out these days anyway, but they should be. That there should be one rule for one.
I mean, you can have a venue the size of Canadian Tire that's empty and create a bunch of tables down the middle where people are coming through, just like a farmer's market, but only allow 40, 50 people. And when they're out, get more in. But yeah, that's not allowed. But that's a whole nother topic. I'm a little hot on that one there. And then we were already chatting about vaccines. There's just so many vaccine information that we're hearing on the internet and on news, whether it's the Russians or the Chinese or Canadians even have it. There's a few states in the U.S. that have, and universities that have discovered, the vaccine. I even heard of some kind of vaccine trials. Apparently, they were taking plasma from people, and they gave it to people that actually had COVID-19, and they seem to have gotten better. Have you read into that at all?
Yeah, that's recovering patients that then provide plasma to the to provide treatment. There was a big do down in the US about this, saying how effective it was, and yet again misinformation came out saying that it was making an improvement on 35% of people, and it didn't. So it's something that has potential in the future, but not at the moment. I think that active vaccination is the way forward. We're moving towards that. We've got some good candidates coming through. Timescales were probably, I was just reading earlier on that Fauci was suggesting that the earliest that it would appear would be at the end of this year, in small numbers, targeting the initial groups of people that will be vaccinated, and then for wider spread, hundreds of thousands going into the spring of next year, and then having numbers up to millions towards the end of the year. So there's still some time to go. And that's one of the forerunners. There's other trials which are still ongoing, but there are only a few of them which are in the kind of the later stage phase 3 trials. So, yeah.
And speaking of which, we have to keep shopping local, help our local businesses out here in the Okanagan. People have been doing that by the droves, and I'm really, really, my heart warms up when I see that and I read about it on social media, and we just got to help each other out here.
Definitely. Yeah, we've got, I mean, everyone's taken a huge hit, and people have innovated. They've gone online. Some of the guys in the local businesses on your shows have shown how they can get through this, but it's not everyone will survive, and it is very hard for people. So we just need everybody to work together to try and get us back to normality, and we'll get there, but it might take some time. Yeah, there's still a long way to go.
Well, thank you, Dr. Pete Henley, for being back on our show.
Okay, you're very welcome. Thanks.
And for everybody out there, I want to remind you, Dr. Pete is also the admin on a Facebook page called Coronavirus Okanagan Updates and Community Support. So once again, Coronavirus Okanagan, it'll pop up on Facebook. It's a great group, and there's some laughter in there, like Dr. Pete just had stated earlier. So jump on Facebook and follow along with him. And don't forget, Hello Okanagan is also on Facebook and Instagram.